Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. As India battles its second COVID wave, we are bringing you this report from inside the COVID ICU ward at the SRV Hospital in Mumbai. Let us take a moment to return our attention to what our doctors and our health workers are going through at the front line as oxygen, vaccines, and even drugs run short. What is happening at ICUs like this one, really the front line of war, and how are doctors and nurses and other frontline staff keeping their calm? To get a sense of the perspective literally from the epicenter, I have Dr. Rupkatha with me, who's in charge of this ICU at the SRV Hospital. First, from all of us, a tribute to what all health workers are doing. This is a very tough phase. What are you seeing on the ground? What is the biggest challenge that you're facing as we walk through the ICU?
The biggest challenge is the shortage of the beds that we are facing, because the number of cases is just overwhelming, and daily we are getting many calls that just they want the patients in the ICU or in the wards, and many of the patients who are actually understanding they need admission, they are not getting ward beds, and eventually their oxygen levels are dropping while they are at home, and they are presenting to us very late and they are straight brought into the ICU. So these are the patients who are very unfortunate, could have done better when they have come, if they could have got a bed earlier, but once they are in the ICU, again, obviously the prognosis goes down like anything.
So, Dr. Rupkatha, basically what you're saying is there are not enough beds, so people are coming late to the hospital, and there's not enough oxygen, so that people can't even really stay at home and make use of that high-flow oxygen. And I've personally been reporting from small hospitals where oxygen is running short. I went 1 hour outside Mumbai and I saw 8 people die in one day at a hospital because oxygen was in short supply. How critical is the oxygen and the bed situation?
Yes, it is extremely critical, especially in the wards. We have put in extra beds where we are taking patients without a central supply of oxygen, but we are taking in extra cylinders in, and then we are starting them on oxygen. We are fortunate enough to be working in the institute where we can arrange for these things, but definitely smaller nursing homes, they don't have this much of resources so that they can arrange for extra amount of oxygen daily.
And what about drugs? I mean, while science has two opinions on whether Remdesivir actually works, and some doctors are in favor of it and some doctors are not, I know that Remdesivir has been in critical supply.
Yes. So what we have seen in the last year, Remdesivir has definitely made a big change in the treatment of COVID, especially if the patients are getting them early. Definitely we say to all the patients, if we are understanding that their oxygen requirement is happening and we are hitting them immediately with Remdesivir, they are doing really well, and many of the patients from the wards are going back home after completing the dose.
So how short is the supply?
Shortage was not there till almost 2 weeks back, at least over here in Mumbai.
And now?
Now we have to ration. Now the things are that we have to ration in certain cases where the patients are young and after 2-3 dosages they are getting better, they are not requiring oxygen anymore. We are not completing the courses in them, but definitely the patients who are still requiring oxygen and are in critical shape and in the ICU, we cannot stop their Remdesivir. We are trying to arrange as best as we can. The relatives are also trying their best. At worst case come scenario, we are giving them prescriptions and they are reaching out to the dealers so that they can arrange.
So patients are having to directly reach out to dealers to find to get the medicines. Now imagine this is how dire it is, and for a moment think of what doctors, because you know what happens, and I've seen this happening firsthand. For example, in the hospital in Nalasopara, ma'am, where the oxygen ran short, patients started protesting against the doctors. Doctors can't do anything, right?
Exactly. That's what we keep on telling, that when the patient is already in the ICU, we are trying our best to do what we can, but once the patient is in the ICU, even Remdesivir, we cannot guarantee that if the patient is getting Remdesivir, he is going to make it, because that is the place where the controversy is. If the patient is having severe COVID and already the disease has spread so much that the lung, almost 80 to 90% of the lungs are involved, in them maybe Remdesivir also is not the only drug that can cause.
So you're short of beds, you're short of Remdesivir, you're short of vaccines, you're short of oxygen.
Yes.
A grim situation. And of course nurses, if you can introduce us to some of your nursing staff, we would love to also talk to them. I know I had met Dr. Anita earlier, and we will get a sense from her also, because they're really the ones who have to look after the patients 24 hours. And one of the things, of course, is happening is that we're all in these PPE suits. So often you can't recognize people. So if you will see, if the camera comes close here, this is Dr. Rupkatha's name written here, and they very nicely wrote my name for me here also. And I think not enough has actually been spoken about what our health workers go through when they have to wear these PPE suits. I'll tell you that through 2020, every time I had to wear one, I would find myself sick that day because of acute claustrophobia. And imagine that these are health workers who wear them every day. And I'm spotting, yes, from her name, I can see the nursing head, Anita, here. Anita ji, सबसे बड़ा चैलेंज क्या हो रहा है?
सबसे बड़ा challenge, if you say this, like we have the manpower. The thing is that the patients are increasing, and day by day, even though staffs have to do double duties and extra hours, and they are ready to pull their shoes and work for it. It's like a year past now, and we were in 2019. We were having a lots of fear in our mind about the treatment, about the medication, about the diagnosis, and everything. They were having fear about how they are going to quarantine and they are going to save the life. But now people have, we are in April 2020 now. We have lots of centers who can diagnose easily the.
But manpower shortage कितना हो रहा है, ma'am?
We do not have that much now, because the staffs are, they are ready to come, because previously it was not like that.
But that was a big problem.
There was not transport.
अभी क्या problem है? और ये PPE, this duty in the PPE, talk a little bit about that.
Yeah, the PPE is like they have to wear all the time the PPE, the ventilation, and the itself, the patient need the oxygen is correct, but the staffs also need some ventilation when they are working. They wanted to go to loo frequently. They have to have their food. But now the support from the management which we have got, that we have lots of PPE available.
But it's still very difficult. There's suffocation hota hoga, and for women in particular, when you're menstruating, it must be even worse.
Yes, definitely it happens. But the thing is that still we are supporting our staffs. Our doctors are there, HK staffs are there, managements are supporting.
आप अपने आप को strong कैसे रखती है?
I have to strong because I am giving positive support to my staffs, and when they are happy, I have to be happy.
So this is how people here, the health workers are really going through hell. And we've had warnings from doctors saying that health workers are exhausted. And I want to talk to a few more doctors, and I'm going to try and talk to them one by one. I can see Dr. Ritesh here. And we're also looking for Dr. Nida. I can spot her here. So let me ask you, Dr. Nida, because one thing we don't understand is that doctors too are either testing positive themselves or have family members who are actually positive. And Dr. Nida here, we're in the ICU, but her mother is in the ward and she is tested positive for COVID. So here's a doctor on duty whose mother is also COVID positive. How do you keep your strength? And tell us a little bit about how your mother is doing.
Currently my mother is doing well. She's admitted from the past 3 days in SRV Hospital on the 2nd floor. Initially she had oxygen requirement and her saturations were dropping. But now with the help of my other colleagues and treatment of the other doctors, she's doing well currently and maintaining on room air. So it's pretty difficult to, manage patients here as well as the home, so that, your family and other relatives out, you are always in a tense position that they might get infected because of you. You take all safety precautions and as much as you can aseptic stuffs, but still somewhere there is a point of thing that you might be a carrier at home to your family, and that is from past 1 year we are serving into COVID, and this is the first time one of my family member got infected. And
so it feels personal this time.
Yeah, it does feel personal, and definitely we can understand each and every patient's feel about the COVID thing, how they are isolated from the family. And now when it comes to your own family, it is a different story altogether.
Dr. Nida, a dean at one of the COVID hospitals in Mumbai was telling me health workers are exhausted. Hum log thak gaye.
True, that is there, ma'am. We found a peak wherein there was a highest scale of COVID, and then we found a dip in the month of Feb. And we were into the position that now somewhere we are, relaxed about COVID. It will go off. But then again, we had a peak again the end of Feb and March. So again, we are into this thing that abhi wapas wo sab karna hai. We have to again be into PPE kit 24/7.
How does this PPE kit feel? Can you talk a little bit about it?
PPE itself is a major challenge for all of us, because once you don in with so much of precautions inside, even when you have to visit a washroom, you have to think twice. You can't eat because you have to doff completely and then don in again. So it's a challenge in our way for us. With all these safety precautions to treat patients, you yourself feel breathless sometimes because you are so much packed up with mask, double layers of mask, and so on. And
how do you keep strong?
Definitely with the willpower that yes, we have to serve the society. We have to stay strong in this difficult times of COVID and make our medical fraternity as well as the society proud.
And you all make us very, very proud. But I have to ask you, Dr. Rupkatha was talking about shortage of beds, of Remdesivir, of oxygen, of vaccines. What is the demand-supply mismatch? How many people are you having to turn away every day?
The demand and supply is having a huge gap because the requirement of beds is on tremendous peak, and we don't have that much amount of bed to be given or to cater to the required patient, because off and on we are getting calls, we need bed, we need oxygen support, but the crisis is everywhere. So not only we are suffering, every hospital is suffering for the same, and we are facing the same crunch of problem everywhere. The oxygen is the biggest issue recently going on because we are not getting proper supply from the vendors. So maximum patients who are in our hospital, they are oxygen dependent. Some are having 15-16 liters of requirement, some have 5-7 liters of requirement. So entire hospital is having huge oxygen demand, and that supply is not getting from.
So how do you all manage, because you're still sounding calm and in control, superhuman almost? How do you manage?
Madam, being a healthcare worker, it's our moral responsibility that we should be on toast 24/7, 365 days. And because our patients and their relatives have hope from us only. And we want to be at every step, every moment to save their life, to give them relax. Okay, we are there. Your patient is in safe hand. So don't worry, we are there for you 24/7.
Aren't your family scared? Let me ask any one of you. Aren't your family scared for you?
Yeah.
And how do you reassure your families?
So we keep all the safety procedure in the time of when you go to the
फिर भी एक psychologically जो डर लगता है उनको कैसे काम रखते हैं?
As a healthcare professional, I chosen this industry. As being a healthcare professional, I have to serve to the society at any cost.
So they have to understand that, right? Let me give the last word here again to Dr. Rupkatha, if I may. Some doctors have saying we are begging, borrowing, stealing. What do we do? What is it that you want people of this country to understand? The biggest challenge in one line.
I want everyone to please wear their masks, use sanitizers, and please maintain distance, avoid gatherings. I please beg to everyone that festivals will come and go if our lives are there. So please, if 1 year we don't celebrate Holi or Diwali, it's okay. But these celebrations are costing lives, and in the ICU we can see people dying each day, and this just breaks my heart that these are the men who were at home working, earning for their family, and they are losing their lives because they went and attended a wedding, or they just went for some celebration and partied one night. So this could have been avoided. Please, I beg to everyone, please stop doing all these things. These are not essentials. If your life is there, you have your whole life to do all that in future. But till COVID is around, please abide by the rules, wear masks, be safe, be at home.
And imagine this, that a doctor in charge of the ICU at the SRV Hospital is having to literally beg what should be common sense. When we go and behave inappropriately, not wear our masks, we take part in mass congregations, we are insulting the risks that all of these doctors and nurses and ward staff are taking. We are not just endangering our own lives, we are insulting the lives lost already. Remember that according to the Indian Medical Association, more than 800 doctors have died because of COVID. And these all around me, you can see all of them here in the ICU. Every one of them, men and women, are risking their lives every single day to try and help people to live. And the least we can do is to actually respect what our health workers are risking. Come here inside an ICU where everything is running short, and I promise you, you will think 100 times before accepting the images that we're seeing of so many mass congregations that are still taking place in our country. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.